Now that we've given you a little bit of the definition of chiropractic, I'd like to go into the differences of regular chiropractic and low-force chiropractic. Chiropractic has been around for over 100 years, and the idea is if there is a misplaced vertebrae, a bone that is out of place, pinching a nerve, causing pain, causing dysfunction, causing weakness or numbness down your arms or down your legs, how are they put back in place? Traditional chiropractic has a way of manipulating bones, putting them back into place. The difference between that and what low-force chiropractic is, low-force chiropractic uses an instrument that will give 4 to 5 pounds of force, which is significantly less than traditional chiropractic, because remember what we said, a bone moves out of place a 1/16 of an inch. Why do we need to move the bone back any more than a 1/16 of an inch? So through this instrument that gives 12 mini adjustments a second, and why is this important? In the beginning, I said that the nervous system fires 12 times a second, every second we're alive. So if the instrument gives 12 mini adjustments a second, it works perfectly with our brain and with our nervous system of putting the bones back into proper alignment, the exact amount they need to be put in, no more, no less. And that's the beauty of this too. Let's just say you have an older person, might have some osteoporosis, rheumatoid arthritis, osteoarthritis, maybe had some broken bones, maybe even post-surgery that didn't work. By using this instrument and working with the nervous system perfectly, it aligns the spine to the exact amount to get rid of the misplaced vertebrae. In other words, getting rid of the pinched nerves to get rid of the problem that caused this problem in your life. Now, let's back up a little bit. If we're talking about pinched nerves, bones that move out of place, well, the concept of what low-force chiropractic is, we put things back into place. So how is this done? There's 3 aspects to pinched nerves that go on in the body. First of all, when a bone moves out of place, it's not in outer space. There's muscles and joints and tendons and ligaments all around these bones. So by relaxing this area, by either using deep heat ultrasound or electrical stimulation to strengthen the muscles and relax the muscles, get deep heat in there, you relax the muscles around the bones. Then the second part is that you put things gently back in place with, we use the ArthroStim manipulator. It's an instrument that gives 12 mini adjustments a second. So now you align the spine, you have the muscles around the spine that are relaxed, and the third component is the disc. What the disc is a gel that is between each one of the bones. The way I always describe it, it's like a jelly donut. Now, as we get older, we actually lose part of the gel. We lose this water part of the gel that makes up the disc. Actually, we become 1 inch shorter when we are 77 years old than we are 30 years old. The reason why, each one of the discs lose just a little bit of water. You have 25 discs, each one loses 1/25 of an inch. Guess what? We're 1 inch shorter when we're 77 years old than when we're 30. So, it makes sense. That's why a little bit of the arthritis occurs and other problems occur, because what ends up happening is this accordion theory of the spine, then all the muscles around it actually are tighter, more inflamed. A funny story with something like this is a lot of times people in the airline industry who want to become pilots, I think they have to be something like 6'2" or 6'3". Well, what ends up happening is every year they have to get measured on how tall they are. So what they do, they make sure that they lie down for several hours before they go for this test. Because remember I said our spine is like an accordion. Do you know that we're actually about 1/2 an inch taller than when we wake up in the morning than when we go to bed? Because what are we doing all day? We're smashing our accordion. So this makes the concept a lot simpler if you think about the disc. We relax the muscles, we put the bones back in place, and the third concept is stretching the disc. This was introduced by Dr. James Cox with his flexion distraction theory, which is actually an exact form of decompression. If a disc is getting smashed, And I always say it's like a jelly donut. Well, if you smash a jelly donut, what happens to the jelly? It comes out. And remember, 1/16 of an inch away from the bones and away from the disc, they're nerves. So what ends up happening is this. By stretching the disc, opening up the disc, decompressing the disc with this flexion distraction technique, what we do is actually open up the disc, and if you have radiating pain from your neck down your hands or from your low back down to your legs, what this does, by stretching the disc, it takes the pressure off of the nerve and gets the blood flow going into your hands and down your legs. So to review it, 3 different parts of the Lowforce Chiropractic. First part, relaxing the muscles, strengthening the muscles. Second part, gently putting the bones back in place. And the third part, stretching the disc. By doing this, the success rate of Lowforce Chiropractic is amazing, with no side effects to people who have osteoporosis, arthritis, any type of degeneration. In fact, a lot of surgeons have referred patients for Lowforce Chiropractic who are about to have surgery, because if you can stretch the disc a little bit, it even allows the surgery to be that much more successful. And that's what differentiates Lowforce Chiropractic from regular chiropractic.